Aloha and welcome to our very first presentation on the healthcare track of the Puna Strong Virtual Resource Fair. I am super excited to welcome you all and introduce Lani Weigert from Hawai'i Care Choices. She educates while sharing her own personal experiences, offering an easy to understand view of how people can still have quality of life while living with serious illness. Her magic sauce is human compassion that is often missing in healthcare. Lani is responsible for educating healthcare providers, medical staff, patients, and their families on the many services offered by Hawai'i Care Choices. She also explains which services are covered 100% under the Medicare benefit. Lani strives to raise the awareness about palliative, hospice, and bereavement care and hopes to provide world-class healthcare choices and solutions for all. So welcome, Lani. We're so excited to have you here.
Thank you, everyone. Thank you so much for that wonderful introduction. I'm really excited to see all of you. You know, it's been almost 5 years since I've been with Hawai'i Care Choices. And prior to me joining the company, they really didn't think that it was necessary to have anybody that's out in the community that's trying to translate the clinical speak to everyday language. And so once I came aboard, it was amazing how there was so much misinformation out in the community about how Hawai'i Care Choices can really come and provide a boost of support and quality of life for not only the patient, but for the families as well. So let's unpack all of this information. I'm so excited to share it with you. And so let's start out with talking about our healthcare. And I'm gonna really do this where if you could ask me questions, I'm just gonna try to think of what those questions could be and just try to answer them as we go along here. So I'm gonna give you the front row seat right now on the information about palliative care and hospice care. I don't know, Keith, do you think that our video boxes are kind of covering the screen a bit? We can minimize that and everybody can go ahead and see the screen better. What do you think?
Sure, we'll give it a shot.
Okay, great. Don't worry, everyone. I'm not going to leave you. I just want to make sure that you have a nice, clean view of our screen. Okay, let's see. All right, there we go. So palliative care and hospice care. First of all, palliative care. People don't even know what the word palliative means. I mean, I was right there with most of you on that. But palliative is really a specialty type of care. It is about easing, about soothing, about alleviating pain, and really easing the suffering that people normally have when they are taking treatment such as chemotherapy, radiation, dialysis, or even coming off a very major surgery. Oftentimes, people have these curative treatments because they are suffering from very serious illness. The serious illnesses that I'm speaking of is cancer of any type, congestive heart failure, COPD, and even kidney failure. And so when these serious illnesses are being treated, oftentimes the symptoms are so uncomfortable. And oftentimes it's mostly pain. So with palliative care, we really focus on providing relief from a lot of that discomfort. So the main focus for palliative care is to provide relief. Now on hospice care, the focus changes. The focus changes to comfort because at that point, no one is trying to do any type of curative treatments. There's no heroic measures that we're going through. We're really trying to allow the illness to take its natural course. And normally, people that qualify for hospice care will be certified by their physician and another physician that they have anywhere from 6 months or more to live. It's the best guesstimate, but normally people will live longer than that. So when when it's time for hospice care, the focus is on comfort. And many people will tell me, oh, I don't want hospice care because I don't want to give up. I don't want to lose hope. And I have to tell you, everyone, that it's the farthest from the truth to do that. It really is about redefining hope and focusing on being with loved ones and doing things that bring you joy. These are the reasons that hospice care is so amazing, for support of all the family and also to bring extreme and deep comfort to the patient as well, because now it's all about the quality of life, no longer the quantity. So how is palliative and hospice the same? There are some similarities. Well, first of all, palliative care is a very large umbrella, and hospice is actually a subset of palliative care. It goes right under that umbrella. And I'm just giving you the specifics so you know the difference. Normally, people sign up for palliative care earlier in their disease process, and it's pretty much for those who are still quite active and traveling, etc. But there are quite a few similarities to palliative and hospice care. Both relieve suffering, both can be delivered at the patient's home, both improves the quality of life for patient and their families, and both create a plan of care. So how are they different? Well, they definitely are different for sure, because palliative care serves those with a serious illness of any age. So we could even have babies, and we've actually had a baby before as well. And for most of the people that are on palliative care, they are still going to live a very active life. I mean, many will live for years going forward. I mean, some people will say, well, I'm feeling really sick. I'm probably only going to live a few more days. And then they end up, living a few more years. So palliative care is very different. Hospice care is normally serving those who have received a 6-month life prediction. That's called also a prognosis. And they're no longer seeking any kind of treatment. So when you look at the two, the journey on their natural progression in their disease process is similar, but yet different when it comes to how far along somebody is in their disease process. Signs that palliative care is needed. None of us are doctors, or maybe there's a few out there, but for the most part, we have no idea. However, we can see physical changes that might be happening to our loved one or ourselves at home. Some of the changes are that the person may seem to be calling their doctor a lot, like, several times during the week or even during the month, or maybe even visiting urgent care or the emergency room several times in a month as well. I mean, those are immediate signs that palliative care is probably needed, because it shows that we need more support at home. And also, we need to really start managing the illness. And some of the things that happen too is that there's so many medications that we are being prescribed that oftentimes it's difficult to remember which one to take. And of course, just our normal activities of daily living, managing finances, driving, going to the store, preparing meals like housework. Sometimes those become very, very challenging, if not able to do any of those at all. When that happens, normally palliative care is needed. And of course, the very obvious, there's so much pain and I'm getting very tired. There's swelling in the feet and legs and just feeling nauseated from all of the treatments that are happening, particularly if chemotherapy and radiation are some of the treatments that someone is taking. Definitely, palliative care is needed. So when I asked our medical director, Dr. Dolan, she would say that the best time to sign up for palliative care is at the time of diagnosis. And that's throughout the course of the illness, the person would be on palliative care. Because remember now, as the illness progresses, then a person would then go to hospice care, which is also under the palliative care umbrella. What's really important about signing up early is that the earlier that somebody signs up for palliative care, the more quality of life we can bring that person as well as their family. And we can teach everyone how to manage the illness so that there are so many more happier days without pain. There are ways to enjoy life even when dealing with a serious illness. If someone is interested in palliative care, they should definitely just call our office. It doesn't hurt to just find out. I wonder if my mom needs palliative care, or I'm going through these following conditions. I just want to know. Do not hesitate to call us, because oftentimes when you call us, then we can determine together whether or not this is services that you need now. And there isn't anything better than having the right time of care at the right time. And often the medical industry just doesn't work like that. It's when somebody remembers to tell you, oh, maybe you should go and see this person or do that, etc. But now I reach out to all of you and say, take your own health care and be responsible for it. I mean, just take it from here going forward, because I find that once you start taking responsibility for your own health care, it's amazing how much you can improve your health going forward. So when we come over to someone's house who has signed up for palliative care, we'll normally ask these kinds of questions at the house during the time that we are admitting somebody into our palliative care program. We would want to understand and know that you understand about your illness. It is amazing how many people will be diagnosed with something, but they don't really understand what's all going to happen in the future, in the near future, about the symptoms due to the illness. We also want to know within the family who else makes the medical decisions for you, because the way that families are, we have so many blended families now. And sometimes we have family members that live on the mainland that maybe are not involved with the day-to-day caregiving. So it's important for us to know that maybe a son that's living in the mainland that happens to be there that week is not the one that would normally speak on your behalf. However, there could be a daughter that has been watching after you and caregiving for you for more than a few years. And you would like us to make sure that she is involved in the decision making. Of course, all of the family could be involved in just understanding about the needs that you have and also your illness. It's also important for us to understand, like, what happens in your house? What are your beliefs? What type of things do you do during the week? Like, some families might have a Bible study on Wednesdays. We would want to know that so that we are seeing the patient on Tuesdays to make sure that she or he is up to a Bible study on Wednesday, and also to keep the home clear of any other distractions so that you folks can fully enjoy the time together. Everything that I've been sharing up to this point is really about the patient. We put everything around the patient, very patient-centered on all of the decisions that we make. And in a medication review, you see this couple here, and they're just balancing all of these jars of medication. It's really no joke. I mean, we have gone to homes where the entire coffee table is filled with all of these medications. And what happens is that Some of the medications belong to the deceased ex-husband. Some belong to the adult children that no longer live there. Some of it is expired, and a whole bunch of it is just coming from the different doctors that the patient is seeing. So how does that happen? Well, there's a primary care doctor that the patient goes to see. And then maybe, there's some incident in the evening, and boom, the patient is taken to the emergency room and they give some medication there. During routine checkups, the person is going to see their cardiologist or some kind of ologist, and they get more medication there. And then, on the weekend, we're heading to town, and, the person can't breathe. So we stop at urgent care and they give more medication. So really, somebody could actually be taking anywhere from 20 to 30 different medications every day. And it is quite a balancing act. When palliative care comes in, what happens is our team, our nurse will come in and take a look at all of the medications, and will contact the primary care physician to go over all the medications. And we find that maybe somebody is taking 31 different medications in the day. After we do the medication review, we find that the person may be taking 18 different medications, which is still a lot, but it's a lot less than 31. And immediately 5% of the discomfort that they were experiencing just slips away. And it's oftentimes because without every doctor knowing what was prescribed prior to them, sometimes the medications do conflict with each other. And without a medication review, without palliative care, it's difficult for that to ever happen. Other services with palliative care. Now, this is another reason that people need to sign up for this if they think that this would be a positive benefit for you, is that we have on our palliative care team our registered nurse, we have our nurse practitioner, and then we also have our social worker. And our social worker will come and explain all of the additional services that are available in the community. And most of them are at no charge at all. So some of the things is people will have Medicare insurance, but they've not signed up for Medicaid, which is MedQuest. And oftentimes they haven't signed up because they don't know how to sign up. They don't know where to get the application. They don't know what it's going to take to sign up. They don't know any of that information. And our social worker will come in and help them. What's the benefit of having Medicaid or MedQuest? And it is that oftentimes if somebody has to go to a nursing home or to a special facility, the room and board will be paid for by Medicaid. So it is so great to have Medicaid whenever somebody is able to qualify. To me, I really feel that it is the Cadillac of insurance coverage for sure, because it will cover everything that any of the insurance companies do not. Also, the social worker does help the patient and the family complete a advanced healthcare directive. And that I'll explain a little bit more on these slides as we go forward. Many people will say to me, there's no way that I'm going to sign up for palliative care or even hospice care because there's no way I can afford it. Great news, everyone. Great news. Anyone that has Medicare or pretty much any type of insurance will be covered 100% at home for hospice care. 100%. Now, for me, when my mother had lung cancer and her doctor told us that, oh, mom can get hospice care at home. We knew that mom, being a pure Hawaiian, staunch woman. She would not go for hospice care at all, largely because of misinformation that she had received prior to us understanding what hospice care could do for us. Anyway, when we went home and we said, Mom, you can get hospice care now, she said, oh, I don't need hospice care. I'm going to live much longer than this. Hospice, that's for those who are dying. I'm not dying yet. I don't need that. So I said, oh, okay, it sounds like you're fully not into it, Mom. She says, yeah, no, I don't need that. I said, oh, okay, well, you know what? I heard that we can get free stuff. She goes, free stuff? What? And then we just looked at each other and I smiled at her because by then my brother was already renting her wheelchair and other little things. And once I realized that once you sign up for hospice care, all of that durable medical equipment is included in the hospice care package. And so when I explained to her, well, I mean, we could just get it for free, it actually was included and I knew that. So she decided, oh, okay, well, if we're going to save money, then I guess we should try it. And we did. And it was just so amazing because a whole team came in to help us. And yes, indeed, all of not only her wheelchair, I mean, she got a hospital bed and oxygen, things that she wasn't even using yet. And all of it was included. Now, palliative care is part of that type of care. However, when somebody comes into palliative care, remember now, they're still quite active in what they're doing. And so we come in to manage their medications, to help them manage their pain, and to really boost their quality of life. All of the durable medical equipment is not included on palliative care when somebody first signs up. It's only included in hospice care. And palliative care is also covered under all these insurances except Kaiser and VA. And it's because they are their own palliative care. So if somebody has, say, Medicare and they don't have Medicaid, there could be a patient copay, and it ranges anywhere from $20 to $40 a visit when the licensed social worker comes to visit or the nurse practitioner. Other than that, all the visits from the registered nurse are already included in the palliative care program. So people will say, well, why do I need hospice care now? If I have palliative care, I should just stay with them. Well, understand that as the natural progression of the disease goes forward, there'll be times where there'll be a higher need for different types of services and care. And I tell you, my friends, there is nothing higher than hospice care. It is an incredible service that people really don't know about, but the quality of life that it brings to not only a patient, but very much so for the family is just amazing. I remember when I signed up my mom for hospice care, and all of the anxiety that we had surrounding mom's illness because we wanted to make sure that she was always comfortable. What are we supposed to do? Why isn't mom eating? All of these kinds of questions were quickly answered, and we were calmly put at ease because we had a hospice team that came. Although my mom was diagnosed with 6 months to live, she lived quite much longer than that. And it was because she really didn't have the stress that happens when you're dealing with a lot of pain and discomfort, because the hospice team would come in and see to that. But I have to say, the quality of life for us as her children just really elevated. And it was because we could be better daughters and sons to her, because hospice would come in and take care of her needs where they were experts and we were not. We were experts at being daughters and sons. So it was very, very good for us to finally reach out and get this care. Oftentimes people will say, oh no, I was raised to make sure that I take care of my family, myself. And it would be shame for us to ask for help outside the family. There is nothing more untrue about this, especially now. I would rather have the experts come in and really give my mom the Cadillac of services than for me to just stumble around trying to figure out what is going to be best for mom. For example, towards the end of life, when mom didn't really want to eat, for those of us who don't know that, all right, she doesn't want to eat, we shouldn't be trying to force feed her. Many of us equate food with love. And so would continue to feed their loved ones and actually get upset and frustrated if the loved one did not eat, because you're thinking, oh, they're just being stubborn and they're not trying to help themselves. When in fact, there's certain things happening in the body that is not allowing them to process that food anymore. And with the education that came with hospice, we were so lucky to just watch mom be kept comfortable and also ask for whatever she wanted and be able to have that. So that was really wonderful that we were able to ease that suffering. And that was the reason that hospice care was created. You know, it wasn't where they came in to hasten my mom's death, not at all. It was really to ease her terminal suffering, and that we felt so blessed about. And it really helped us take a look at what was important for us and our family. So it wasn't where we lost hope, you know, we gave up hope. It really redefined it for us. And we were able to spend all the time that we could, not only ourselves, but our grandkids and everybody, because then we realized what was really important. And there wasn't anything more important than the love of our family. So indeed, it takes a village. As you can see on your screen, there's a whole team that gets assigned to your loved one. Besides the registered nurse and also the nurse practitioner, there's also a medical director. And oh, our volunteers are amazing. You know, a lot of times people will start with palliative care program and they will move to the hospice care program. And oftentimes they want to go wherever their volunteer is going. And that's the kind of bond that gets created with our trained volunteers. It's just amazing. And then of course, our social worker, our certified nurses, aides that come to the home and groom the patients, bathe the patients, make the patients feel human again, to feel that dignity and respect of, yes, I'm sick, but she made me feel so much better. Many times people are so connected to their nurses aides, and it really is the care that and compassion that happens between the patient and their nurses aides that is so wonderful. And of course, the earlier that somebody signs up for hospice care, the earlier that they can qualify, the sooner all these wonderful benefits can go to the patient and the family. And really, like myself, my mom was able to live longer because we signed up, because our doctor was so amazing and signed up, you know, let us know that it's time to sign up, mom. I'm so happy that he did, because if he had not, we would have no idea that this was something that mom could benefit from, that we could all benefit from. So I tell all of you out there, if there is a loved one that is dealing with serious illness, please call us. It doesn't cost you anything to make the call or even to just ask for this information, because if you can get these benefits as early as possible, please try to get them. My mom said to me that, you know, my father had died 2 years prior, and it was from congestive heart failure. He did not have hospice, and boy, did we see the startling difference of him having or not having. And now that my mom had it, we really felt sad that he didn't have it as well. So like I said, for palliative care, we're not doctors. How would we even know if it's time to call for hospice care? Well, again, if your loved one is going to the emergency room or calling the doctor several times during the month, the week, even during a day, it's probably time to find out if your loved one needs hospice. And then there's some obvious signs, they're losing weight. They become so fragile and frail that they're falling down a lot. They tend not to be very hungry or thirsty. And it's difficult for them to, lift themselves out of a chair or even out of bed. All they want to do is sleep most of the time. And then they also start to have recurrent infections on the skin and within the body. And so these are definite signs that your loved one may need hospice care, and definitely call us so you can find out. Even if your doctor doesn't tell you, you could call us and we could call the doctor and let the doctor know that you are concerned. And so the doctor would still be a part of whatever is decided for your loved one with regard to future care. It's just that we want you we want you at this moment to just take responsibility for your health or the health of a loved one that's near you. Because oftentimes when we would wait for the doctor to let us know, during the once a year checkup, it is so easy to miss a lot of the things that's happening, such as these types of things that are happening at home. I would often say to a doctor when I'd ask, "Oh, how's Mr. So-and-so doing?" And then the doctor would say, "Oh, he's doing fine and he doesn't want hospice care." I said, "Yeah, but I noticed that his wife is getting very frail when they come into your office. And that is a clear indicator that she needs support at home. And that indeed is when somebody should call hospice. Because of course the patient doesn't feel that there's any need because the caregiver is doing all the caregiving. Meanwhile, that caregiver is not sleeping, is not eating well, is actually becoming almost sicker than the patient. And it is so devastating to watch when the caregiver passes before the patient. And believe me, that happens more often than we'd like to admit.
Well, every single person in Kupu Care was like an angel. They were right on. They helped me. And then when it got really bad, so the doctor finally acquiesced. But the doctors, I think, take too long to plug people into the home health care they need. He got hospice finally, and he was with them almost 2 weeks, and then he passed away. But I could have used them way before. And people need to be informed, by the doctors about Kupu Care so they can get them plugged in to the help they need. Otherwise, they're going to be in the situation I was in, which was pretty intense for quite some time. Thank God for Kupu Care. And all the people in hospice were angels. They were wonderful, beautiful people, beautiful, so supportive.
Well, one of the reasons why we went to Kupu Care was that my husband had found out that his illness was probably going to be progressive and not curable. So he was a little anxious, and so was I. During that time, after he was diagnosed, his idea was spend as much time with the grandchildren so that they would be able to, I guess, remember. He had spent a lot of time with the community, and so he wanted to spend more time with family. And I think Kupu Care allowed him to do that. As far as quality of life goes, I think it was exactly what my husband Barry wanted.
Thank you so much. We just wanted to share some testimonials from those who have tried our services and what their thoughts were after their loved one had passed. Now, why is an advanced healthcare directive important? That came up earlier in the presentation. So what happens is that if a loved one is unable to speak for themselves, then an advanced healthcare directive provides direction for the family to really provide the wishes of their loved one when they can no longer speak for themselves. So normally what happens is a patient would designate a trusted agent to voice their wishes in the event that they are unable to provide direction to the medical staff. And pretty much anyone 18 years or older should have an advanced healthcare directive. This is probably the most important gift that you could give your loved ones, because besides it being free, it is so difficult during a crisis to try to figure out what your loved one wants and hoping that you're making the right decision for them, when by having an advanced healthcare directive, there's so much peace, there's so much calmness, there's so much comfort in knowing that you are carrying out the directions of your loved one. And that can only happen when someone does their advanced healthcare directive. So who does the advanced healthcare directive? Well, if anyone signs up for palliative care or hospice care, we will definitely have our social worker walk the patient and the family through doing the advanced healthcare directive. However, for those of you who maybe do not need either of those services yet, I just wanted to let you know that in November there'll be one, and it's a virtual presentation. But even beyond that, if you just keep this information with you, you can find out when the next one will be. And that will be very important. And as you see here, I have the links as well as the QR code and the people that do operate these presentations. And so I really encourage everyone, if you're 18 years or older and you don't have an advanced healthcare directive, please get one done. And you can do so by registering with Community First Hawaii. Now, part of the advanced health directive question also asks the question of, do I need a POST? And a POST stands for a physician's order for life-sustaining treatments. It's normally a green paper. People will say to me, do I need to get one? Should everyone have one? And my question or my answer to that is no, not everyone needs to have one. Typically, it's for those who are seriously ill and very frail individuals. And normally, this is a doctor's order. So the EMS personnel that comes to a home would need to follow this. And basically what it is it's saying whether or not you want CPR. And we found that for those who, were very old or very frail, they did not want CPR because CPR can be extremely traumatic for some, to the point that physically it can even break the ribs from the compressions that need or have to happen in order to resuscitate someone. And so when a POST is signed, the resuscitation process will not happen if that's how somebody chooses. So again, the POST is an actual physician's order, and people, when they have that, they'll put it up on the fridge or anywhere that is easily accessible to the EMS personnel should they need to come to the home. of Pohaimolama Care Center. Some of you may have been here, may have visited it, and if there are those who have not, you are in luck today, because we have a very, very short video that will just show you how it looks on the inside. This is like the Mauna Lani of hospice. It is a transitional care center where people will come because they have symptoms that they simply cannot control at home. So they'll come to this patient care center and we will manage those symptoms. Once we get them managed, then we'll send the patient home. But I have to say that more than 95% of the patients that come to this facility normally pass at this facility as well. And it's such a beautiful place to pass when that time comes. In fact, people will even ask me if they can make reservations to stay here, but they have no idea that you have to be actively dying to stay at this facility. So by the time they find that out, then they realize, oh, okay. Well, in any case, it's such a beautiful place to see. It has 12 wonderful suites, private suites for the patients to come with a private lanai as well. And so people that come here, they will come here who are on hospice. If they do not have Medicaid, Medicaid will cover room and board, but if they do not have Medicaid or other insurance besides Medicare, they can normally pay directly, a private pay, in order to pay for the room and board on here. But without further ado, let's take a look at how Pohaimolama looks on the inside.
Welcome to Hawai'i Care Choices, Pohaimolama, a Harry and Jeanette Weinberg Care Center. This is a state-of-the-art short-term care facility designed to feel like the most beautiful home you've ever been in. A spacious living room to gather your entire ohana together. The meditation room provides a beautiful space overlooking the gardens to find solace and quiet contemplation. Nothing feels more like home than gathering the family for dinner around the TV, which you can do in the family room while the keiki play in the room next door. Each suite is designed for maximum patient and visitor comfort, with sleeping areas for guests, private bathroom facilities, and each room even comes with its own private lanai overlooking the lawn and gardens. When you or your loved one are in our care and you need some extra care, there's no place like Pohaimolama. For more information, call us at 808-969-1733 or visit us online at hawaiicarechoices.org.
So our mission, to improve the lives of those we touch by offering support, guidance, compassionate care of body, mind, and spirit. And all in the areas on the map that are in color, those are the areas that we provide service. So Lapohoihoi all the way to South Point in Ka'u. Our friends at North Hawaii Hospice and Kona Hospice provide services to all the other areas on the map. And so it's quite harmonious how we all work together to ensure that everyone on the island is provided with hospice care. So throughout the presentation, I have been reminding you to please, if you have any questions or you're just not sure, it doesn't hurt or cost anything to just call us. So please write down this number and this email, because we are waiting for you to give us a call. Our patient care assistants have so much information and will be willing to help you with whatever question you may have. And of course, you can ask your doctor, and he or she will give you information on whether or not it's appropriate or time to sign up for either our palliative kupu care program or our hospice care program. And we also have bereavement care as well for those who have lost a loved one. With hospice care, there's 13 months of bereavement support that is provided by our team. And so definitely call and ask for that information. We also have community group support as well for those who might have lost a loved one unexpectedly and maybe a car accident or some type of really last minute situation that a loved one is lost. And so by all means, call us for that as well. Oftentimes people will say, you know, I really didn't need hospice care. And so in fact, I didn't even know that it existed. Well, if I put it to you this way, in just terms of service, let's just say all of us are going to have a seat on Heaven Airlines. Some of us will go at 12 noon, some will go at 2 p.m., some will go at 8 o'clock at night. But make no mistake, we're all going to go at some point. For those who have signed up for hospice care, for whatever reason, they knew about it, they called us directly, doctor referred them, whatever the reason, all of those patients and their families go directly to the first class cabin. And the reason they go to the first class cabin is because that is where all the comfort and service resides. So they go all up to the front. Now, everyone else who did not sign up for hospice care, because they didn't know about it, or they were reluctant to sign up for it, or they just were afraid, whatever the reason, they do not go to the coach part of the plane. They, in fact, go to the baggage compartment of the plane. And the reason that they go there, this is the patient and all of the patient's family, is because that is the coldest, roughest, most horrendous ride to the end that anyone could even imagine. And so I tell you that for everyone that goes to the first class cabin and their loved one crosses over to heaven and the rest of the family flies back, although it is a tough ride back, it still is one that people are able to get more support when they disembark. And that support continues for 13 months. For everyone else that took the most horrendous, coldest, roughest ride back, oftentimes they break into millions of pieces and very, very difficult to pull their lives back together. So I tell you, my friends, for those who sign up for hospice care, wouldn't we all want our loved ones to fly first class?
That was wonderful. Thank you so much, Lani, for sharing your incredible knowledge and the wealth of information that you shared with us today. We did have a few questions that came in during the presentation, so if I could get those over to you. One of the questions that came in is, during a natural disaster, such as an eruption, are people still able to access your services, and how does that work?
Yes, if there is a natural disaster, we still have a 24-hour call line that they can contact us through, and then we will have the care team contact the patient. If the patient is not yet signed up with us, we still will have the access, the 24-hour access to assist and help others that call.
Excellent. And then what safety protocols has Hawai'i Care Choices implemented during this COVID pandemic that we're in?
So our protective equipment that we need to wear, our face masks, our face shields, our gloves, booties, all of the coverings for the body, that's very much a mandatory thing for all of our staff. But also we are communicating with the patient and their families well before our visit, because we really are trying to separate the rest of the family from the patient when we come to visit, to manage the social distancing in the home as well. So all of that pre-communication it really is important when we're going out to visit a patient, and to keep the patient and the family safe as well.
Excellent. And then another question is, how do you care for LGBTQ families or individuals who might not have the same family support structures that like a heterosexual family might have?
Well, having a caregiver is really important with regard to signing somebody up for our services. And the reason that is so that we can call the caregiver, should there be any additional needs that we want to ask them to relay onto the patient. But sometimes we will even take patients who maybe have a family friend or neighbor that lives nearby that understands the needs of that particular patient, and we will in fact work with them. So we try not to be really rigid on how we are providing care, but we just want to make sure that the patient, should they need someone to look in on them, that they in fact have somebody to do that. And that has happened several times in the past already.
Oh, wonderful. And the last question that we have for you right now, Lani, is somebody who has experienced hospice care writes in and says that they really appreciate and admire all the work that you do, and they want to be a part of it. Are you hiring?
Yes, in fact, oh my gosh, what a wonderful question. We are. Please go to our website, which is hawai'icarechoices.org /careers, and come and take a look at what we have available. With this pandemic, it's been so interesting with regard to where people choose to get their care. And many of them have actually come to us, and the community is just rising up and taking responsibility for their own healthcare, and they would prefer to have their healthcare at home, which is why many of them have called us. And thus, we need some very, very good people to come and join our team. And so, yes, please do not hesitate. We are really a fun group to be with.
Awesome. Thank you so much, Lani, for joining us today. And thank you, everybody, for sticking around and writing in such great questions. We really appreciate everything that you do. And stay tuned because our next session will start at the top of the hour. Take care. Aloha.
Mahalo, everyone. Aloha.